Welcome to the Depression and Anxiety Recovery Program introductory session. Today we're going to be talking about an exciting program that has been well documented in the scientific literature in lots of different analysis and studies. The brain is very amazing. In fact, it's so amazing it's the most complicated structure ever investigated by science. That means it's more complex than the space shuttle with all of its computers and systems. It's more complex than the most complex computer. It has 100 billion nerve cells made up of thousands of different types of cells. Over 100 trillion synapses. This is the connections in just your 2.5-pound brain that makes the national debt even seem like a small number in comparison with these amazing connections that you have. And there's all sorts of different types of neurons. The brain can resiliently regenerate and rewire itself through neuroplasticity. That means we can change our brain's destiny once we learn how to harness this power. And that's truly amazing. No other complex structure can change itself. And by learning principles to be able to change, it always requires all sorts of outside help and interventions and never can do it by itself. But this neuroplasticity is what this program is based on. In other words, if the brain can change, which any human brain can, that means depression, anxiety, and mental illness can be eradicated, and we can live a very flourishing, positive life. And the brain can learn, retain, and apply knowledge gained over its lifetime. And this program is also based on learning and retaining and applying knowledge that can help our brain change for the better. So there are many disorders of the brain simply because the brain is complex. Any complex structure is going to have things go wrong with it. The space shuttle mission, engineers have stated on every mission there were things that went wrong with it. It was so complex. Sometimes things went very wrong, as we know in history, and very bad outcomes occurred. And so when we have a complex structure, we need to recognize things can go wrong with it. And so there are disorders of the brain. A mental illness is defined as a clinical diagnosable disorder that significantly interferes with a person's intellectual, emotional, or social abilities. So if it's interfering with your ability to learn, with your feelings and emotions and social abilities, it's a mental illness. And these mental illnesses have been increasing because the causes of mental illness have been increasing. Over 1 in 4 people around the world, approximately 2 billion, are living with a mental disorder. Just over 1 in 3 adults suffer from a diagnosable mental disorder in any given year in the United States. Over 44% of Australians aged 16 to 85 experience a mental disorder during their lifetime. And among adults, mental illnesses are now most common in the younger age group, 18 to 25-year-olds. In fact, if you're 13 to 18, that means you're not even an adult. 49.5% of 13 to 18-year-olds now have a diagnosable mental illness. That means it's almost more common to be normal these days than it is not to be. But fortunately, these things can be reversed. They don't have to be lifelong conditions. Mental illness is so common that you have to know someone with it if you don't have it, or even if you do. And so really, there's only 2 groups, those that have a mental illness and those who know someone with a mental illness. Some people have tried to correct me and say there's actually 3 groups, Dr. Nedley. There's another group that causes other people to have a mental disorder. But if you're in that group, you actually have a mental disorder because that's affected your social aspect of things. And so depression and anxiety, out of all the mental disorders, are the most common diagnosable mental disorders. And there's a lot of different refined diagnosis underneath these 2 that we will specifically deal with as part of this program, as well as common varieties of depression and anxiety. So how can I know if it's depression? The Psychiatric Bible defines it the same way I do in regards to the clinical symptoms together that make up depression. So let's take a look at those symptoms. The first one is deep sadness or emptiness. If you have any of these symptoms, I want you to consider investing in this program. It'll be well worth it if we can just rid you of one of these symptoms. But our data shows that we can rid you of many, if not most, of these symptoms. So if you have sadness, feelings of emptiness, if you have apathy or loss of interest, this is where you get up in the morning and you're not excited about the day. If that's happening more often than not, that is a significant symptom. If you're more irritable, or if you've noticed that your brain is slowing down, or if you've noticed that your body is slowing down, that's a symptom. Sleep disturbances. It may be that when your head hits pillow, you can't go to sleep. Your mind keeps going. That's called insomnia. Even more common is you're able to go to sleep, but then you wake up too early and can't get back to sleep. That is very common with depression, and the more severe the depression, the earlier you tend to wake up. Or what about if you're just wanting to sleep all the time? Hypersomnia is a sleep disorder. Any of those sleep disorders can be helped by getting to the root issues behind depression and anxiety. Weight or appetite changes. You might be overweight, not because of what you're putting into your body, but because of your mental health. You might be self-medicating your depression with junk food. And just trying to get rid of the junk food is not enough. You have to get to the root cause of depression, and then you'll lose weight. Some people are anorexic and they can't gain weight, and they're underweight, and they're losing weight. If we correct the depression and anxiety behind it, then they'll come up to a nice normal weight. So weight or appetite changes on either side qualify. Lack of focus and concentration. If you're reading through something that's interesting to you and you've gotten to the bottom of the page and you can't remember what's at the top of the page, that is lack of focus and concentration. This program is for you. Fatigue. If you've run out of energy too early or you wake up and you don't have enough energy, this program is for you. If you have feelings of worthlessness, that's a sign that you have depression and even irrational thinking. Because if you have any ability to be of use to yourself and others, you're clearly not worthless. But if you start thinking you're worthless, this program is very much for you. Or if you've had morbid thoughts where you're even thinking at times, I think I might be better if I just go to sleep and don't wake up. That's a morbid thought. Or if you're thinking and resonating with death or symbols of death. Now, you don't have to have all of those symptoms for depression. You have to have 5 of 9 to have a major diagnosable clinical depression. But even if you have 2 of 9, if it's not symptom 8 or 9, that's abnormal. That's minor depression, and you can also significantly benefit. Well, you may not have depression, but you might have anxiety. Anxiety is excessive fear or worry about a variety of topics, events, or activities. And this is very common among all anxiety disorders, is that you have this fear and worry. And you're going to have usually several of these 6 symptoms in addition to fear: feeling on edge or restless, where you feel wired, muscle aches or soreness. So many people have told us after they've gone through this program, they're able to throw away their pain medicine, and all of their chronic pain conditions they thought were physical were actually due to the anxiety. And then the rest of the 4 symptoms are actually similar to depression: become fatigued and worn out, concentration problems, irritability, difficulty sleeping. And so any of those symptoms can be significantly improved and been well documented to improve by participating in the 8-week program that we're about ready to tell you about. Well, most commonly, these conditions and mental disorders are treated with medication. It's still the #1 treatment. Nature magazine actually highlighted a whole issue on depression, and they stated in a study conducted in real clinical settings, a common antidepressant produced a response in just under half of the participants and achieved full remission in only 28%. That's not very good for the #1 treatment. And that's why Nature magazine said we have to get outside of these traditional methods. They're not working all that well. And why is it that it's still #1? We need more treatment modalities. 5 decades of work on antidepressant drugs have not made them more likely to lift people out of depression. Medications and psychotherapies help some people with the disease, but fail many others. As an internal medicine physician, I was aware of this. I saw it in my patients. I saw in patients that I prescribed it to. I noticed they were also having side effects, and some of them actually quit taking the medicine without even telling me because they thought the side effects were worse than what they were dealing with. And I'm not against medicine. As a physician, I can prescribe it as well, and I do prescribe it for those that need it. But I recognize that this is not enough. Even traditional counseling, along with medicine, does not seem to be enough. So as an internal medicine physician, I went to how I was trained. How I was trained to help people was to find the cause of disease. And I had done that with heart disease, for instance, coronary artery disease, atherosclerosis. It can have multiple causes, and if we reverse those causes, the coronary arteries can open up just through nutrition and lifestyle measures. And I thought, could this be possible with mental illness as well? And I wasn't sure. And so I went to the scientific literature trying to find the causes of depression, and I began to find more and more causes that were reversible. And I found over 100 causes of depression and anxiety, most of which can be reversed or treated through simply education and health coaching. And as I began to look for which of these causes were active in each patient, then address those through education and coaching, I began to see dramatic improvements beyond my original expectations. I must admit, I was hoping to do maybe close to what medicine was doing, because I thought it's the #1 treatment, it's probably the best treatment. If I can get close to what medicine's doing, this would be good. But I began to be shocked when I saw improvements far beyond what traditional medicines would do in the vast majority of patients that I was treating once we found the underlying causes. So when people started dramatically improving, that it had depression and anxiety for life, coming to see me, they started telling everyone else in their community. And pretty soon all of my slots were filled up. And my workers were saying, you can't see every depressed and anxious person in this town. I was wanting to because I knew I could help them, but I just couldn't physically do it. And so they said, you need to let other people know about this. And so we wrote a book and we developed this program. And now over 10,400 people have gone through this program with documented before and after results, part of a research project on every inhabited continent. And it's exciting to tell you how well this program has worked, and I know it can work for you as well. What mental health conditions have been shown to be improved? You can see this entire list, all the different forms of depression, all the different forms of anxiety, even conditions that don't necessarily fit under anxiety and depression, like eating disorders, obsessive compulsive disorders, post-traumatic stress disorders, addiction disorders. This program actually works better if you're addicted to something than if you go to a community addiction program. That's what the studies have shown. And even attention deficit hyperactivity disorder can improve by engaging in this program and finding the underlying causes. So expect transformative change. You might ask the question, well, what if I'm already under a healthcare provider's care? What if I'm already taking medicine? Is this something that's not for me? No, this is complementary. It works in addition to medicine. In fact, most people that come to the program were on medicine, and as a result of getting better, they were eventually able to be weaned off of their medicine, and they felt better without the medicine than they used to feel with it once they no longer needed it. So this is something where you need to continue to see your doctor. We're not telling you to stay away from your doctor. You need to continue to see your counselor, but this can work in addition in a complementary way to bring about that transformative change. The goal of the program is to empower you to make changes that will transform your life, and you will learn how to combat depression and anxiety using evidence-based interventions and therapies. Everything that we're telling you is evidence-based. In addition to addressing what you do with your body or put into your body, you will learn the gold standard of psychotherapy that can transform your thinking to be helpful and accurate. We don't just deal with the hardware of your brain and get your brain ready for neuroplasticity. We get it ready for transforming the software of your brain in regards to thinking helpful and accurate thoughts that will not only help you, but other people around you. So over 10,000 people so far have successfully completed the Nedley Depression and Anxiety Recovery Program in every continent except Antarctica. Over 7,000 of them had a form of depression. Over 6,000 of them qualified as having diagnosable significant anxiety. And of course, the others had other issues, or they were just there to optimize their brain, because even a normal person can experience brain optimization by getting the brain even more neuroplastic. Those with severe depression at baseline, 94.5% improved at least one category. So in other words, they were no longer severe in just 8 weeks. Now we call this program a 20-week program, but we start to see results significantly even before the 8-week point in 94.5%. Those with moderate depression improved, over 90% improved, and if you came with just mild depression, there was a very high likelihood supermajority that experienced zero depression. In other words, their depression was gone by the time the 8-week part was up. And over half of all depressed patients no longer qualified as having depression after 8 weeks. This is simply with health education and health coaching combined, using our volunteer staff that are compassionate and will help you through step by step. What about anxiety? Anxiety is known to be more difficult to treat than depression. It requires higher doses. It can be a significant lifelong issue if we don't deal with the underlying cause. And once again, over 94% came in with severe anxiety. Their anxiety scores improved significantly, down at least one category. Many also left with no anxiety. 89.8% with moderate anxiety improved, and if you came with mild anxiety, 85% chance you no longer had anxiety in 8 weeks. And even a greater percentage of anxiety patients had no anxiety, 57.1% in just 8 weeks. That's even before the 20 weeks is done. Well, you can imagine that this is gratifying to recognize that this mental illnesses that are so common can be reversed and addressed in simple measures, and you can be in charge of your own destiny. What inhibits some from not taking advantage of educational or therapeutic programs? Many wonder, is it worth it? Because there's costs involved. You have to have books, and you have to do some things on your own and get materials and some tools to help you. When you consider the loss of $300,000 across the lifetime, the earlier you can get treatment, the better off financially you and your family will be. This is a study a number of years ago showing that if you have lifelong depression and anxiety, you are going to be $300,000 down during the course of your life than if you were able to treat that early and reverse it. Several $100s is the best investment if it gets rid of depression and anxiety and improves your emotional intelligence, which this program is also shown to improve your relationships, and increase your usefulness and employability. Scores of individuals have mentioned how their wages went up after this program because their emotional intelligence improved. They were getting raises. They were now being in charge. And what a difference it made in their life. And of course, they weren't having to struggle with depression and anxiety. So the number one regret of those who have gone through the program, we've analyzed this, is this quote: "I wish I would have known or would have done this earlier in my life, but I'm sure glad I did it now." And so no matter what your age, we've had people as young as 12 and people as old as in their 90s go through this program. And it's not age dependent whether you're going to improve or not. Sometimes the young people improve quicker because their brain is ready for more changes, but no matter what your age is, you can benefit from this. And then there's a bonus. The added bonus that we did not anticipate when we started this program was the improvement in emotional intelligence, which is influenced by heredity, family, whether you've had abuse or neglect, even your entertainment choices, your current level of social and emotional support, and physical factors, how well you're sleeping, what you're eating, whether you're exercising or not, and even how you're thinking and your thinking patterns. All of these things are addressed in the program, and we have documented significant improvement in emotional intelligence. That means improvement in your relationships, more effective work productivity, often results in greater employment and wage opportunities, increase in healthy motivation, which will result in greater accomplishments. Many people with anxiety and depression have lost their motivation, but when we improve their emotional intelligence, their motivation to do healthy things goes up, and they start having a better brain. So I encourage you to enrich your life with the Depression and Anxiety Recovery Program. There's incredible value in this program, which includes not only the educational presentations, but personalized depression, anxiety, and emotional intelligence level assessment. This is a risk factor analysis that is diagnostic, that can screen for those over 100 causes to see which ones are active in you, and then you know exactly what to work on in order to reverse this. A very valuable test that will be taken pre and post so that you know also your improvement at 8 weeks, and if there's other things that you can work on. You'll get program materials. You'll also get social support by our volunteer staff. Many of our volunteer staff have been where you have been. They have been through this program, and they want to help others, and they'll be able to really identify with you. And last but not least, the program value is also the group and personal accountability. Story after story from Community Depression and Anxiety Recovery Program alumni share how they found personal accountability by being a part of the Depression and Anxiety Recovery community. Week after week, they discovered that they were more resilient than they ever knew and more capable of making positive lifestyle changes and sticking with them than they ever realized. My trained team is committed to helping you find strength and motivation week after week, and are here to provide you that loving support wherever you are on your journey. You are more than a statistic. You are a deeply valuable individual with a story to tell and a future to explore. I know bad things have happened in your life, beyond your control. I get that. But while your journey is unique, you're also not alone. Around you are countless individuals who can resonate with your emotions and are unsure what hope, happiness, or recovery look like. Hope is not passing you by. The healthiest brain and body will bring you more happiness and fulfillment than what you can realize, I understand, at this point. But this is the decision-making point of the presentation. This is where you decide to continue to live the life the way you are now, and you already know what that looks like, and you know it can even get worse with the messed up world that we're in. Or you give yourself these 8 sessions with the certified coaches to help you become the best version of you possible. You will then be in control of your own destiny by the decision you make today. Thank you very much. I'm Dr. Neil Nedley.